Radiation, it's all around us. But how much are we actually exposed to every day? And how does it compare to something as intense as cancer treatment? Today, we are breaking it down. Before we talk about radiation, let's quickly go over the two main types, non-ionizing and ionizing. Non-ionizing radiation is on the lower energy spectrum. These are lower energy electromagnetic waves with lower frequency. These include microwaves, radio waves, visible light, and even our cell phone signals. Ionizing radiation is on the higher energy spectrum. We see it has a higher frequency, and we call it ionizing radiation because it has enough energy to knock out electrons from atoms, and the threshold is usually 10 electron volts. Ionizing radiation include X-rays, gamma rays that we typically use in medical imaging and even cancer treatment. Now let's look at how much radiation we actually experience in daily life. Believe it or not, we are exposed to radiation every day. It comes from natural sources like cosmic rays, radon gas, and even foods like bananas. How much radiation do we get from these common sources? The annual background radiation is about 3 millisieverts. So keep this number in mind and we will compare it to other numbers. Here are more examples. An airplane travel is about 0.04 millisievert. It is comparable to a chest X-ray. These numbers are well below the annual background radiation level. These exposures are very low and not a cause for concern at all. Next, let's look at medical imaging radiation levels. Here are some typical example numbers. For dental X-ray, it's 0.005 millisievert. A chest X-ray, 0.1 millisievert. A CT head scan, 2 millisievert. A CT abdomen scan, 10 millisievert. PET scan, which use radioisotope for functional imaging, is about 25 millisievert. Again, these numbers are still considered very low and safe for diagnostic purpose. Next, let's compare it to the radiation dose levels for cancer treatments. Radiation therapy is in a completely different range compared to our everyday exposure, even from medical imaging. Instead of measuring in millisievert, we use gray, and 1 gray is 1000 millisievert. Here are some typical numbers. A single fraction of radiation therapy is 2 gray, or 2000 millisievert. A full treatment course, which has several weeks of treatment, 2 gray per fraction, can be 60 gray, or 60,000 millisievert. For brain stereotactic radiosurgery, or SRS, we can safely administer 20 gray in one session. These are extremely high number compared to our everyday life exposure, but remember, these numbers, they are used to deliver in a very targeted way to kill cancer cells while sparing surrounding normal tissues. So to put everything into perspective, should you be worried about everyday radiation exposure? Absolutely not. The doses from these sources and even medical imaging are extremely low and well within safety limits. We can see here our annual background radiation, 3 millisievert, and the most imaging, they are well below this number. For radiation worker, our annual limit is 50 millisievert, and even this is an extremely safe number. Radiation therapy is on a completely different magnitude, but remember, these are used as a tool to kill cancer cells while sparing healthy tissues. So understanding these different exposure levels help us make informed decisions, whether it's about getting an X-ray or undergoing radiation therapy. But to really put radiation risk into context, let's compare it to other health risks. Background radiation, or even from medical imaging, we can see 10 millisievert, which is about a CT abdomen scan. The risk is extremely low compared to other health risks. For example, a smoking has 2,000 times higher risk compared to a CT scan medical imaging. And therefore, risks from radiation are very low. The bigger threats to our health come from lifestyle choices, such as smoking and overweight. That's all for today. Radiation is part of our world, whether it's from space, food, or life-saving medical treatments. I hope this video helped to put radiation into perspective. If you found this helpful, don't forget to like, subscribe, and comment with your questions. I love to hear from your thoughts. See you next time. Bye.